It's been well documented on Real Men Wear Gowns that guys need to do a better job of taking care of themselves. One of the best ways is preventative care. That means regular checkups.
By 35, making sure that we know kind of what the cardiovascular risk is for a patient. By age 45 or 50, knowing about risks like colon cancer, prostate cancer.
Dr. Dieter Heinz says it starts with a conversation.
The transparency is a very good thing to keep in mind. Many men are sometimes pleasantly surprised that their provider has had similar experience or has certainly had experience treating patients with common disease states, common concerns.
During an appointment, Dr. Heinz gathers an overview of the patient's health. Do they take day-to-day medications? Have they ever been diagnosed with an illness? Do they have any active symptoms? What is their family history?
Many people having fear of diseases that they may not actually be at risk for. So you might actually walk out of the doctor's office with tremendous reassurance that A, you're in good health, or B, you're actually at less risk than you thought you were.
Routine checkups, screenings, and tests can catch a disease before it starts, but health really begins with diet and exercise.
Try not to leap on to fad diets or anything, but moderate exercise most days of the week, portion control for your caloric intake, obviously avoiding known issues in terms of tobacco, overstimulant use.
Medical science has proven preventative care helps find and stop health issues before symptoms arise, but it's all useless unless you take the first step and make an appointment.